When this video is released, I will be in Rimini, Italy, presenting at the International Association of Dance Medicine and Science at their annual conference. The annual conference is held in a different country every year, and this year I was very lucky it's being held in Italy because both of my abstracts on tango were accepted. So this is my first time as a presenter. I owned a busy outpatient private practice clinic for 20 years and never had the opportunity to participate in such a conference. And now that I have some more free time on my hands, I am able to do it. This will be the first time that tango is going to be presented at this conference. This association, the members include physicians, orthopedic surgeons, physiatrists, podiatrists, physical therapists, psychologists, just to name a few. And they convene on a regular basis to talk about recent studies that have shown better cross-training for dancers, rehabilitation techniques for different types of injuries and surgeries, the latest surgical procedures, and so on. This organization has presented on everything from Irish dancing, ballroom, ballet especially, and they try to include all kinds of different dance forms, and inclusivity is very big with this association. And one of the things they loved about tango when I was putting in my abstracts was the fact that it is gender fluid. Men can lead men, women can lead women. You can learn both roles, leader and follower, and that's what makes it really fun and interesting. The first thing I'm going to present on is a poster for adapted tango. Adapted tango is tango that has been adapted for patient populations. The patients that participated in the 58 studies that I looked at, I did a literature review online of a lot of different people that do adapted tango. Everyone from Argentine tango instructors in concert with research staff or medical professionals teaching classes, to their 3 different schools or certification programs for adapted tango. One is a Sistema Denzel that was developed in Argentina and is now taught at the University of Burgundy. The other one is Dr. Madeline Hackney came out with a manual and a methodology of teaching tango to different types of primarily patient populations with Parkinson's. And then the last is this Neurotango, which was developed by a German concept designer. So those were the 3 main programs, but then also just Argentine tango instructors in concert with the research professionals were able to teach classes as well. And with that, people were partnered, the patients that had Parkinson's disease, depression, anxiety, balance disorders, post-stroke with hemiplegia, even caregivers participated in this study as patients because of the anxiety and stress that they had with caregiving. The patient populations were teamed up with volunteers. Sometimes their spouses or their caregivers would be there to partner with them. And most of the time, the partner that was not the participant or patient was someone that was trained in how to assist with any stumbles so that people didn't lose their balance and fall. So that was one of the main differences with adapted tango versus a regular tango class, in that you had to really be wary of people losing their balance and be trained in how to accommodate for that. The other big difference was the arm hold. The arm hold, instead of traditional tango Argentine embrace, was holding what's called an open ballroom embrace, where you hold each other's elbows. Not my favorite situation because you tend to use your arms a lot with that, but this is the preferred way to teach adapted tango. And the cool thing is most people that participated in all these different studies, I looked at 58 of them, wanted to continue after it was done. And so as rehabilitation experts, we are always looking for things that are cost effective, that have high motivation rates so that people are really vested in continuing with a program, and something that is really beneficial. And the benefits of adapted tango from these studies included much better balance, and there were specific tests like the Berg balance scale and get up and go test. All these things were used, but in a nutshell, balance got a lot better, upper extremity mobility got better, functional mobility, being able to get up and down out of a chair more easily, Things like spatial awareness, being aware of others in the space and be able to navigate obstacles. That can be very difficult for some people in some medical conditions. Mood was much better. Depression decreased. Anxiety decreased. So there's a lot of very promising studies out there with adapted tango. And so I put together this poster that enumerates like all the benefits of it, how it was implemented, about the systems of teaching, and so on. So that's one thing. The second abstract that I had accepted is that I'm going to teach a basic tango class. And instead of doing a PowerPoint presentation where I point, with a monitor, I decided to teach medical professionals about the biomechanics of tango and how faulty biomechanics can lead to injury by having them participate in a basic tango class. We can't be experts in all forms of dance, but if a practitioner has a general idea of the demands of the dance, they can better assess injury and come up with more appropriate rehabilitation solutions for any particular problem. And within that class, I'm also going to be talking about tango footwear. I'm going to dispel some myths and get practitioners aware of what to look for when someone comes in for an appointment, so that they also bring their tango shoes with them so they can assess them very quickly with that as well. Wish me luck. This is super exciting for me. If you see me in the future, please feel free to ask me about this extraordinary experience. And I'm going to show you a little map of where Rimini is and the place where we'll be presenting. This is where I am in Rimini, Italy, this little red mark on the map of Italy. And this is the Palacongressi di Rimini, where I will be doing my presentations. Ciao!